All right, welcome to the kind of flow portion for your rolling out your middle section, hips, glutes, low back. So I want you to have just kind of a quicker version of how to release this. In the course, we go through the deep dive of it, but I want to give you kind of just like, I don't have a whole lot of time. I just kind of want to get in here and release this in a quick way. So we're going to need our foam roller. We're going to need, I like both the balls, the harder and the softer. So I use the Yamana ball, but softer version, and then this is the whip ball. So have those on hand. We're going to start on our roller. We're just going to kind of loosen up our legs, big muscles of our legs really quick. So let's start on our quads. So you're going to be face down. Get that roller underneath your thighs. Start with those toes pointed straight down towards the floor. You're just going to relax your legs into the roller. Breathing. So as we kind of do a little bit of a check-in and release this middle, right? We're going to release our hips, our psoas. We need to think about all the big muscle groups that attach into this section, right? So we're just going to do a quick release of our glutes, our quads, our IT bands. We'll get, we go deeper into those when we do our leg stuff, but so you're pointing straight down with your toes. This is kind of neutral in your hip. You're relaxing those quads, and then go ahead and externally rotate. So you take heels together, toes apart. So now you're getting a little bit more of those inner thighs. Breathing. Again, this is going to be just kind of a quick check-in. So if anything grabs your attention and you feel like you need to go deeper into this, you can either hit pause and keep going, or you can certainly do the deeper dive in any of the courses in the full class. Another couple of breaths here. And then we're going to go right onto our sides, into our IT band. So onto your side, I like to be on my elbow. That top leg can be on the floor in front to take some of the weight off. And you're just rolling along the side of your body, that IT band. If it feels like you're able and you want to stack those legs on top of each other, great. You're trying to breathe, you're trying to relax. Just checking in with things, getting some blood flowing. Breathing. Again, the whole point of all of this is that you have a very good sense of where your tissue is day to day. So like today, as I roll out, I'm kind of like, yep, it's par for the course. Things feel pretty normal. There are days that I've done like a lot of hiking or a lot of working out and things are really tight, and I will spend more time. I'll hang out here. I'll get it to release a little bit more. But if things feel pretty good and you've checked in here and you've gotten a little bit of blood flow, fantastic. Let's switch sides. So again, this is you checking in with your body, doing what needs doing. So again, that other side IT band, if you want your top leg on the floor in front to take some of the weight off. You can shift that top hip forward in space a little bit to get more on your quad. You can roll backwards in space to get more onto where it attaches into your hamstring. Try checking in all the way from your hip down to just above your knee. Don't roll over your knee joint. Breathing. And I say this in the main class, but for those of you that really can't tolerate this, which I get, it's intense, use a softer roller or use like a tiger tail, like a massage stick. It's a way to get in here and release some of the stuff in a little bit more of a tolerable fashion. Let's just take a couple more breaths. Good. And then we're just going to do a little quick check-in with our glutes before we get in deeper with the ball. So you're going to sit on the roller, hands behind you on the floor. Knees are bent, feet are flat on the floor. You're just going to roll those knees over to the left. So I'm on my left glute, front to back, side to side. We're just checking in, breathing. You could add your figure 4 stretch here if you like. You can cross that left ankle over your right knee. So I'm stretching the left side and I'm rolling the left side, right? Some days this is where I really feel it. Some days it's with my leg down. Let's go to the right side. So shift those legs off to the right. Again, front to back, side to side. Maybe you add your figure 4 stretch, right ankle over left knee. I'm rolling on that right glute. And so because we're doing sort of the abbreviated check-in today, or not the really, really deep rollout, maybe during this glute rolling, you sort of pay attention to like, oh yeah, it's right there by my sit bone. That's really tight. And that's where you go with the ball, right? As opposed to what we did when we were in the class and we sort of methodically checked through all the tissue. So go ahead, come off the roller. Let's grab the wit ball. I like the firmer of the two, but certainly if things are sensitive right now, use the softer. You're going to come onto your back. Knees bent, feet flat on the floor. We're just going to lift up and we're going to take that ball. We're going to start in our low back. Again, we did this in the class, so this should not be new stuff, but just as the quicker version. So you're going to be just off center. You're not on your spinous process. You're just kind of in the curve of your low back on that left side, maybe an inch or two from center. Let yourself kind of sink down. You might not feel it a ton right now because we've got that arch in your low back. So then we're just going to start to tip your pelvis a little bit. You're going to rock your pelvis. So you go into a posterior tilt and then come back out of it. So press your low back down towards the floor and relax out of it. So the nice thing here is you're in charge. If you just move a half an inch and that feels like enough pressure, then that's where you stay. Good. So just getting some release. Again, I'm not right on my spine. I'm just off to the side. Breathing. And as always, you're in charge of this. You should always be able to breathe and relax into it. If it's too intense, it's making you brace and hold your breath. Ease up. Go more gently. Use a softer ball. Maybe you do this against the wall. This might not be what your body needs right now, right? You listen to it. So then you could also sway side to side. So I'm going to come into a little bit of a pelvic tilt, and then I'm just going to swing my hips off to the right. So the ball just swings out to the side a little bit. I'm getting in those erector spinae muscles, which run the length of my spine. I'm getting a little bit into my quadratus lumborum. Again, we go deep into all this in the class, but we're just kind of doing a quick pass through. This is really great to hydrate this tissue of our lumbar spine, get our thoracolumbar fascia loosened up. I'm going to move the ball a little bit lower. And then I'm just going to start to move all the way down into my glutes. So I'm just kind of working through this low back, top of my glute. So I just move it down. I'm going to keep kind of swinging my hips side to side, rolling around. Maybe if you find a spot that feels really tight, intense, good. I don't know how you describe it. Hang out there. Breathe. And then we're just going to work our way into our glutes. So think about the whole left side of your glute, right? From midline all the way out to the side of your hip. Check in with all of it. So maybe you're just sort of doing big motions where you're kind of swinging and rolling the ball along, and then you're searching for it. It's like, ooh. Or maybe you're remembering from when you did the roller, like, oh yeah, it was in this outer hip or down towards my sit bone. Or we're just going to do a couple minutes on this side. So not super deep, not super prolonged. Like I said, if you feel like you're onto something and you need to hit pause and get in here deeper, great. But we're just sort of touching base with things. Remember, when you're in this middle and outer hip, you can let that left knee drop out to the side. Sometimes that gets in there a little bit deeper. When you find a spot, you just kind of breathe and melt into it. Moving it around. Breathing, softening. So just sort of touching base with that whole glute and hip, finding the spots, getting a little bit of blood flow, getting a little bit of circulation. Again, we're not going super, super deep. Just touching base. Rolling around all through that hip, through your glute. Good. Couple more breaths, and then we'll switch sides. Like I said, if you need more time, hit pause. Do a little bit more. Otherwise, this is a great just sort of quick check-in. So here we go. We're going to switch to the other side. You're in that right side now. I'm going to bridge up, get the ball just off center in my low back. Maybe an inch or two from the center on the right. Relax down into it, and then start with those pelvic tilts. Tipping your pelvis and relaxing it. Breathing. You can do this in a chair. If you have a chair that has a decent back that you can kind of push against. Like I said, the wall. You can swing your hips side to side. So I'm kind of lifted up a little bit. A little slight bridge. Swinging my hips off to the left. And again, just kind of let yourself, where do you need to be? Is your body wanting you to go a little bit higher, a little bit lower? I think we all have that sense of like when you just want to push into something, right? Sometimes if your back is sore, you just put your fist back there and you just kind of push on it. That's what this ball is for. Hydrates the tissue, gives your body a different input. So then just kind of start to work your way down. As you get into that meatier part of your glute, you're probably working out to the side a little bit more towards your outer hip. We're thinking in terms of this whole butt cheek, right? The whole side on the right. Check in. So as we're doing this more broad stroke check-in, you're probably doing a lot more kind of rolling around. But I want you to be feeling it, right? So if you get into a spot that's like, oof, Really feel that? Then hang out there for a second. Breathe, soften. And remember, if it's more middle of glute, outer leg, sometimes turning that hip out, externally rotating and opening it can be the thing that really gets you in there. Soften, soften, melt, breathe. Remember your rules. You should always be able to breathe into it, relax. And even if it's intense, it should lessen in intensity as you're hanging out there. If it's ramping up, then you need to just move somewhere else. Ease up a little bit. Breathing. Take another couple minutes over here. Wherever you need to be, check in with all the places. Just breathing. Sometimes check in with the rest of your body, zoom out a little bit, make sure you're not holding a bunch of tension in your neck, your shoulders, your jaw, your feet, your hands. Just try to relax here. Good, couple more breaths. So this is sort of right on the edge of, remember I say when we do really deep releases, we want to always wake up the muscles. This is a little bit like not quite as crucial. We haven't spent as much time doing the deep release, but I do want you to do one bridge before we flip over and do our psoas really quick. So come on off the ball. Feet flat on the floor. So you can just let your pelvis rock back and forth a little bit, maybe flexion extension. So just kind of getting that back moving a little bit. And then just press up into a bridge, just gentle. Lift your hips up. Just kind of waking this up for a second. Come back down. Do one more. Press up. Good. And then we're going to flip over onto our belly. So I like to use the Yamana ball here. Sometimes it's just about it being a little bit larger. Some people use the alpha ball, the yoga tune-up ball that's a little bit bigger. You can certainly just use the whip ball if that's what you have. Just kind of see what feels right. Sometimes you just don't feel it enough when you have a smaller ball, but check in. So here's our psoas, right? You're going to be on your belly. You're going to feel for that hip bone in the front. I'm on the left side. I'm going to take the ball right inside that hip bone, maybe up a tiny bit. And then you're just going to relax everything down to the floor. So you have to relax your abdominals. And I want you to feel something. So when you get in here, I want you to find a spot to start that you feel a little bit of release, a little bit of tightness. Something's happening. If you're not feeling anything, I want you to kind of shift around a little bit. Maybe you move the ball out towards that hip bone more, or in, or up, or down. Shift it by just a little bit and see if you can't feel into a little bit of release. And just breathe here. Again, softening your abdominals, relaxing. And again, we've done the deep release. I took you through the deep release in the full class. This is just a quick, kind of abbreviated check-in. If you need more time, take it. So we're going to go through our motions. If you're really feeling it here, or at any point as we progress along, just stay at the same spot, right? So to wind up this tissue, the first thing we check in with is bending your left knee. And then you can take that leg in and out, so internal, external rotation. Move that ankle inside, outside. Again, if you get, so say I take my leg and I let my ankle fall in towards the midline and that really winds things up, just breathe there, soften. If none of that is changing the picture, you can straighten your leg back out and prop yourself up on your elbows. Remember here, we're kind of thinking of dragging your rib cage away from your pelvis. So I'm kind of pulling into my arms. I can side bend, so I can pull my rib cage away and then off to the right. That ball's on the left. I can bend my knee also. I can internally, externally rotate. So we're just trying to kind of find some spots, get some release. And I think the thing to remember is that it sometimes takes time to release these things, depending on how tight it is. Like you're not going to release all of it all at once. This is just about chipping away at it, peeling the layers of the onion a little bit, making a little bit of a change. Maybe you do a little bit now, you come back to it later, tomorrow. Breathing. The other thing you can do in this position is to straighten your left leg back out, and you can take that, so the ball is on the left. You can take your right knee up and out and check in with this position. You can bend that left knee again and internally, externally rotate. This is always the one I feel the most. So I've got the ball's on the left. My right leg is up and out, externally rotated. I bend my left knee again, and then I let my left ankle fall into midline. So for some reason, this always does it for me. I feel really a lot of tension in this position and a lot of good release. Let yourself move, let yourself breathe. We'll just do another minute or so on this side and we'll switch. This psoas and hip flexors are a big player in this low back tightness. I find if you're having that kind of tightness in your low back where you stand up after sitting and it takes you a little while to kind of like stand up straight and unwind, check in with your psoas. Another couple of breaths. Good. And then unwind everything. So straighten out both legs, bring them back down, bring your upper body back down. Take the ball out. We're going to switch it to that right side. So place it just inside that hip bone. Breathe. It's very, I would say, rare for both sides to be equally tight. Usually one side is much different than the other. Always, always, always check in both sides, especially here in the pelvis. Don't get into the habit of saying like, oh, it's my right side, it's my problem side, and just do your right side. No. So you get the ball under there, you breathe for a couple breaths, and then you can start checking in with all the things, right? Maybe you bend your right knee. Maybe you internally, externally rotate that leg. If that's not really winding it up, maybe you press up onto your elbows. You can traction that rib cage away, maybe off to the left. Take your upper body side to side. Add your knee back in as well. So you're lifted in your upper body. Maybe you bend that right leg. Internally, externally rotate. Again, whatever, you're just looking for it. Looking for the tension. Maybe that left knee up and out. Breathing. Softening. Always remember to relax your abdominals. So they will tense up kind of over and over again as you move your body. Just breathing. We'll take another couple minutes. Keeping those rules in mind, right? You should always be able to breathe and relax into it. If it's so intense that it's making you brace against it or hold your breath, ease up. Go somewhere else. Move the ball a little bit. Don't put so much pressure. Maybe it's not the time to do this. Listen to your body. You're in charge. We're just going to spend another minute or so, and then we're going to do a lovely little hip opener on the roller. Low back release. So again, this was just a very, very abbreviated check-in, abbreviated version, but it's kind of just a nice, quick way to touch base with all this tissue. And then please know that if something is really calling you, spend the time to release it. Dive deeper. A couple more breaths. Good. Make your way off that ball. Just take a breath here. Maybe shift your pelvis side to side. Rock your pelvis back and forth for a breath. Good. And then we're going to come back onto our back with our roller. We're just going to do a really quick hip opener release of this low back and our hip flexors. So place the roller underneath your legs. Come back onto your back. You're going to bridge up, bring the roller underneath your low back. And here I like to have the roller on skin. So maybe you lift your shirt up a little bit or pull your pants down a little so you can kind of have the roller gripping the skin of your low back. Bring one knee in towards your chest and then the other. Hands come to the roller and you're just going to gently push the roller away from your head. So you should feel that that kind of pulls into that fascial tissue just a little bit. And then just start to play with the position of your legs. So let your knees fall in towards your chest. You can just push gently through the roller. You can push a little bit more. And then you can let your legs go side to side. So I let my knees go off to the left, get onto that left hip a little bit more. Maybe to the right. You can play with where your knees are in space. So I go over to the left and I let my knees fall closer in towards my chest or away. Just kind of feel into that release. Keep the back of your neck nice and long. Breathing. Sometimes I like to rock my knees side to side. So maybe you're right in the center, maybe you're off to the side. And if the roller gets a little too far from where you want it to be, you just bridge up again. Lift it up a little bit higher. And go off to the right. Just check in both sides. Again, we're just going to do kind of a quicker version. Breathing. Maybe knees are close in, maybe you let them go kind of out, away from you. Maybe you're right in the center. Whatever feels good. It's a great way to get a nice quick release in your low back. So take another breath or two. Again, if you need to pause and you want to keep doing this, by all means, go ahead. But we're going to go into just a quick hip opener. So place your feet back on the floor. You're going to just make sure that roller is right about at your pelvis, so right at your sacrum. You're going to bring your right knee in towards your chest, hold it in there, let the left leg go out long. Softening here. You should feel this in the front of this left hip. Opening up, breathing. If you don't feel this, maybe move the roller higher or lower to try to kind of feel into this. You should feel the opening and the stretch through the front of this hip. Breathing. This is a really great one if you're sitting a lot. Instead of being in flexed position in your hip, you can really open up. Take one more breath here. Let's switch sides. You're going to bring that left knee in towards your chest. Right leg goes out long. Back of your neck nice and long. Good. Breathing. Lovely. And then to come out of this, you're going to place both feet back on the floor. Lift your butt up off the roller and come back down. Take the roller out. We're just going to do one little knee push to just wake up our psoas, wake up our core. So bring one knee in towards your chest and then the other. Toes pull back towards you. Hands come to the fronts of your thighs. Gently start to push your hands into your legs. Don't let your legs move. It's really good to kind of wake these things up after we've changed the shape of the tissue. So just holding here. Breathing. Doesn't have to be intense. Just a gentle wake up before we hop back up. 2 more breaths. Good. Belly gently pulling in. Last breath. Beautiful. That's where we're going to leave our quick rollout for this middle section. Again, you can always dive deeper with the full releases in the full course, or you can just hit pause and hang out in a place. Drink lots of water. Good job, you guys.